1 in 5 young people aged 13 to 18 has or will develop a mental illness in their lifetime. Knowing is very important. Half of mental illness show early signs before a person turns 14 years old, and 3/4 of mental illness begins before age of 24. If you are looking to learn more about mental health and want to help someone suffering from mental illness, then you have come to the right place. Hi, this side Anjali. I'm a registered nurse with a master's in obstetric and gynecological nursing. I have been working in the field of health for over 7 years and helping everyone, especially women, to stay healthy and informed. And you are watching to the SC Nursing Hub. In today's video, I'm going to show you how to identify mental illness, and also we will be looking into a severe form of PMS, that is premenstrual syndrome. If you are ready to dive into the world of psychology and learn how to identify and treat people with mental illness, be sure to stay tuned for the rest of my video. And don't forget to subscribe to my channel SC Nursing Hub, one stop for nursing care and nursing classes. And also hit the bell icon for the notification. I'm always adding new content and I want to be your go-to resource for all things about health. Now let's get started. Today we are dealing with nurturing women's mental health. Before we dive into our knowledge of psychology, mental health, mental illness, how to treat our mental illness, I would like to tell you one thing. All those symptoms which I am going to deal with today are not sex unique. They can be seen in men as well as women. Mental health affects men and women differently. But some disorders are more common in women, such as depression, anxiety, etc. These symptoms or these mental illness do come to the woman when they are facing some hormonal changes, such as prenatal depression, like before labor or during pregnancy, around the time of their period, that is menstrual cycle. Like today's generation, they used to say if any girl is having their menstrual cycle or the menstrual cycle is coming on the way, and if she gets irritated, so she used to say like I'm PMSing. So these all things, they come due to hormonal changes in our body. But today I'm leading you somewhere which the girl might be having PMS, but the most noticeable thing of PMS, or we can say the severe form of PMS, that is Premenstrual Dysphoric Disorder, that is PMDD. We are going to deal with PMDD later in this video. How we can diagnose that she is having PMDD or PMS, or also we will be dealing with how we can treat the PMDD, which is PMDD. It is a severe form of premenstrual syndrome, aka PMS. It can be a severe and chronic, which need attention and treatment, which we will be looking further in this video. Before we lead to PMDD, that is premenstrual dysphoric disorders, I would like to take you to the common mental illness symptoms, which can lead to many other disorders or syndromes, which we can assess and which we can treat before. These symptoms are very different, but they are not sex unique. It can cause to a man and it also can cause to a woman. The common symptoms of mental disorder or mental illness are, which can be seen in women as well as in man also. And we can identify it by looking them, assessing them, and we can consult as soon as possible. The first symptoms is persistent sadness or feeling of hopelessness. हमेशा उदास रहना, हमेशा नेगेटिविटी सोचना, निराशाजनक थॉट्स लेके आना. These are the symptoms of mental illness. Next, is noticeable change in mood, energy level और appetite. ध्यान देने लायक परिवर्तन जैसे कि ऊर्जा का कम होना, किसी चीज में ध्यान अच्छे से नहीं देना या किसी चीज में मन अच्छे से नहीं लगना. These are the noticeable changes you can catch in mental ill people. Next, difficulty sleeping or sleeping too much. ज़्यादा सोना या नींद ही नहीं आना रात भर, दिन भर, है ना, सोए नहीं है. Next is appetite or weight changes. Either they are eating more and more, either they are not eating, either they are eating less and gaining much weight. Weight changes are there, which is very noticeable. वजन का कम होना, ज़्यादा खाना, कम खाना, ये सारे चेंजेस हमें मेंटल इलनेस की ओर दर्शाते हैं. दो सब सिम्टम्स लीड नहीं करते हैं हर एक मेंटल इलनेस को और हर एक मेंटल डिसऑर्डर्स को, बट येस, इफ इट अकर्स मोर फ्रीक्वेंटली, मोर इन नंबर एंड मोर इन सीवियरिटी, अगर ये बहुत ज्यादा हो रहा है या बहुत बार हो रहा है, रिपीटेडली हो रहा है, तो दैट कैन लीड टू डिसऑर्डर्स. ये हमें लीड करता है डिसऑर्डर्स के लिए. मिसयूज ऑफ अल्कोहल, ड्रग्स और बोथ. दर्द नहीं है फिर भी हमें दर्द की दवाई लेनी है. दिस इज द मिसयूज ऑफ ड्रग्स. नींद नहीं आ रही है तो नींद की दवाई लेनी है. इट हैपेंस समटाइम्स, डेफिनेटली. कभी कभी हम जब ज्यादा थके रहते हैं या ज्यादा परेशान रहते हैं तो इट फील्स लाइक वी हैव टू नम आवरसेल्फ. हमको थोड़ा एंटी एंजाइटी ड्रग्स लेना है, बट नॉट इन फ्रीक्वेंट वे. हमेशा लगातार वो लेना, इट इज अ मिसयूज ऑफ द ड्रग. एंड शराब पीना, ज्यादा शराब पीना, दिस कैन लीड टू मेंटल डिसऑर्डर. नेक्स्ट इज डिक्रीज एनर्जी और फटीग. जैसे थकान लगना, एनर्जी किसी में हम खाए हैं अच्छे से भरपेट मगर एनर्जी हम अपना यूज नहीं कर सक रहे, तो दैट इज ऑल्सो अ सिम्टम्स ऑफ मेंटल इलनेस और मेंटल डिसऑर्डर. एक्सेसिव फियर एंड वरी. ज्यादा डर या ज्यादा चिंता करना. सीइंग और हियरिंग थिंग्स दैट आर नॉट देयर. वो चीजों को देखना, महसूस करना, सुनना जो कि वहां पे है नहीं मौजूद, तो दैट इज ऑल्सो अ सिम्टम्स ऑफ मेंटल डिसऑर्डर. एक्सट्रीमली हाई और एक्सट्रीमली लो मूड. या बहुत ज्यादा काम करेंगे, बहुत ज्यादा एनर्जी दिखाएंगे हर चीजों में, और बहुत ही कम एनर्जी या बिल्कुल भी डिक्रीज एनर्जी रहेगी. दैट इज ऑल्सो अ सिम्टम्स ऑफ disorders. एक headache, digestive problems with or without any cause. हमें कोई भी एक कारण नहीं है हमारे बॉडी में जिसके कारण हेडेक होगा या स्टमक एक होगा या बैक एक होगा, बट स्टिल वी आर फीलिंग ऑफ हेडेक एंड वी आर फीलिंग ऑफ स्टमक एक, बिना किसी स्पष्ट कारण के सर दर्द या पेट दर्द का होना. एंगर और इरिटेबिलिटी, चिड़चिड़ापन, गुस्सा करना बहुत ज्यादा, दिस इज ऑल्सो मेंटल डिसऑर्डर सिम्टम्स. सोशल विड्रॉवल, अकेले रहना. यस, एवरीवन नीड्स देयर प्राइवेसी, everyone needs their me time, everyone needs their space, but every time you don't need, you have to be socialized. आपको बात करना है, आपको लोगों से मिलना जुलना है. अगर आपको ज्यादा अकेलापन लगता है या अकेले रहने में अच्छा ज्यादा लगता है और आप उस कारण से लोगों को अवॉइड कर रहे हो, लोगों से दूर जा रहे हो, दैट ऑल्सो can be the symptoms of mental illness, mental disorders like depression. Next, thoughts or behavior that interfere with work, family or social life. हम चिंता करते हैं, हम सोचते हैं, everyone thinks about their future, everyone is worried about what they are going to do next. But these all anxieties and these all tensions, if hinders your personal life, family life, social life, it can be a symptoms of mental disorders. अगर आप चिंता कर रहे हैं, आप सोच रहे हैं, that is good. आप aware हो for next future. बट इफ यू आर थिंकिंग, अगर आप बहुत ज्यादा ही सोच रहे हो जिसके कारण आप अपने फैमिली में साथ नहीं बिता पा रहे हो, अपने फैमिली के साथ नहीं रह पा रहे हो, आप अपने सोशल लाइफ में अपने दोस्तों के साथ, अपने कलीग के साथ आप अपना लाइफ को एंजॉय नहीं कर पा रहे हो, दैट may be that mental illness symptoms. Next is thoughts of death or suicidal attempts. Failure is something which everyone, like each and everyone who is most successful to the least successful in the world, they all face failure. But that doesn't mean कि हम suicide कर ले, we end our life. That is not the end of every problem. या ऐसे कोई thoughts जिसमें आत्महत्या का विचार आ रहा हो, ये भी एक मेंटल इलनेस या मेंटल डिसऑर्डर्स का सिम्टम्स है. इफ यू आर फीलिंग of suicidal attempts and if you are feeling that to end your life is your solution, then place your hand into your chest and feel the beats which is beating, and these heartbeats give you purpose, and they all beats have a purpose for you in life. So don't get upset, आप निराश ना हो. वो जो आपकी हर एक धड़कन है, दैट इज वेरी इंपॉर्टेंट, वो बहुत महत्वपूर्ण है और आपके लिए एक उद्देश्य है जीवन में, तभी वो चल रही है. इफ एनी ऑफ दीज सिम्टम्स is seen in you or people around you, I want to make it clear once again that these symptoms are not sex unique. It can be seen to women as well as man. Now we will be dealing with PMDD, that is Premenstrual Dysphoric Disorders. As said before, it is a much more severe form of PMS, that is premenstrual syndrome. It may affect women of childbearing age. It is a severe and chronic medical condition that needs attention and treatment. Lifestyle changes and some medicines can help manage these symptoms. And what are the symptoms? How we can treat it? What are the causes? We are going to deal in further. Now, causes. What causes PMDD? The causes of PMDDs are not known. It may be due to abnormal reaction to normal hormones changes that happens with each menstrual cycle. And these hormonal changes causes serotonin deficiency. Serotonin is a substance basically which is found in our brain and intestine, which help in narrowing the blood vessels and can affect mood and also can cause physical symptoms. Now, what are the symptoms? How we can know that PMDD, it is occurring to my woman or to me or to the woman I know? It appears during the week or before the menstruation and end within a few days after your period starts. These symptoms disrupt daily living tasks. Symptoms of PMDD are so severe that women have trouble functioning at home, at work, and family and relationship. This is remarkably different than other times during the month. PMS, it is something which happens to some severity, not much, and it doesn't affect your lifestyle. But PMDD can affect your lifestyle. It can hinder your work, it can hinder your relationship, it can hinder your work life, family life, etc. Now, what are the symptoms which we can identify so that we can treat, or we can identify that it is the PMDD cause and it is not a general PMS? The symptoms are psychological symptoms like irritability, nervousness, lack of control, agitation, anger, insomnia, difficulty in concentrating, depression, severe fatigue, anxiety, confusion, forgetfulness, poor self-image, paranoia, emotional sensitivity, crying spells, moodiness, trouble sleeping. These are the psychological symptoms. Fluid retention symptoms like swelling of the ankles, hands and feet, periodic weight gain, like when you are going through premenstrual phase, the weight gain is done, diminished urine output. During that period only urine output is being decreased, breast fullness and pain, gastrointestinal symptoms like abdominal cramps, bloating, constipation, nausea, vomiting, pelvic heaviness or pressure, backache. These all symptoms appear within the premenstrual phase. Eye complaints like vision changes, eye infection, respiratory problems like allergies, infections. Other symptoms like skin problems, acne, skin inflammation with itching, aggravation of other skin disorders including cold sores. Neurological and vascular symptoms like headache, dizziness, fainting, numbness, prickling, tingling or heightened sensitivity of arms and or legs. Easy bruising, heart palpitation, muscle spasms. Other symptoms like decreased coordination, painful menstruation, diminished sex drive, appetite changes, food craving, hot flashes. These all symptoms can be alarming signs for PMDD, that is premenstrual dysphoric disorder. Now, if you find these symptoms, the question arises how we can treat it. PMDD is a serious and chronic condition that does need treatment. And these treatments and some life changes can help to suppress the PMDD symptoms, like changes in diet to increase protein and carbohydrate and decrease sugar, salt, caffeine and alcohol during those periods, regular exercise, stress management, vitamin supplements such as vitamin B6, calcium, magnesium supplements, anti-inflammatory medicines for any inflammation or infections found, selective serotonin reuptake inhibitor SSRIs. As said before, PMDD is caused due to the diminished or deficiency of serotonin level in our brain and intestine, which leads in narrowing the blood vessels. So we have to accomplish those deficiency by taking the serotonin reuptake inhibitors, that is SSRIs. These all medication drugs like vitamin supplements, anti-inflammatory medicines, these all supplements and these SSRIs should be taken via the prescription of your physician. So if you find out these symptoms in you as a woman or a woman nearer to you, then ask that woman to go to the physician and to consult to your physician, gynecologist or psychiatrist that these all symptoms are being seen to me during the menstrual phase. So these are the treatment or how we can treat the PMDD symptoms. See, mental health is essential for overall well-being and it is important to nurture the mental health of women. There are many things that can be done to support women's mental health, including talking to them openly and honestly. This helps to reduce stigma and shame and it encourages women to seek help if they need it. If you're finding these symptoms in your mother, in your sister, in your sister-in-law, in any of the women around you, don't hesitate to talk. Because the first cure of a mental illness is to talk. As long as you don't know how they think, how she think, how he think, you cannot cure a mental illness. Next, creating supporting environment of women that includes providing access to affordable and quality mental health care, as well as creating safe and supportive space for women to connect with each other. These supportive space should be provided to each and every woman working or each and every woman non-working. Empowering women to take control of their mental health. This includes teaching women about mental health and self-care and providing them with the tool and resources they need to manage their mental health. See, nurturing women's mental health is very important because it benefits women themselves, their families, their communities, and overall world. When women are mentally healthy, they are more productive, more engaged in their relationship, and more likely to contribute to their community in positive ways. Here are some specific things that you can do to nurture the woman's mental health. Listen to them. First of all, it not only apply to women only, as I said before, because these symptoms are not sex unique. If any of the symptoms which is being seen in any of the human being gender apart, you have to first listen to them, talk to them, and you have to offer support, encourage self-care, and be understanding and patient. Because if anyone have to answer you, you have to first listen, and listening patiently is your first priority. Nurturing women's mental health is a shared responsibility. We can all play a role in creating a more supportive environment for women and in helping them to achieve their full potential. I would like to conclude my video by saying that mental health is as important as your physical health. Your mental illness doesn't define you. With these words, thank you for watching. I hope this video has been helpful. If you or someone you know is struggling with their mental health, please reach out for help. There are many sources available and you don't have to go through this alone. For more such informative videos, hit the bell icon so you can get the notification, and also subscribe to my channel SC Nursing Hub, one stop for all your nursing classes and care. Me Anjali signing off.